Good morning. Exam 3 review, chapters 8, 9, 10, and 11. Okay, we'll cover 11 tomorrow morning. So chapter 8, where we have our electrolytes, fluid imbalance. All right. A couple of things to reinforce is ascites. What is it? And paracentesis. What is that? So what does it include? All right. Need to know that table 8.1, some clinical manifestations of electrolyte imbalances, and know some normal ranges. What do we do? What do we expect to see when it's high and low? Sodium, potassium, calcium, a couple of the top ones. All right, what are our manifestations for that? Hypocalcemia, where what is a clinical manifestation for that? What regulates our calcium in the body? All right, alkalosis, pH levels. What's our normal pH level? What's considered basic and what's considered acidic? What are the buffer systems? How many are there? How fast does the first one work? Minutes, seconds, okay, and which one is it? The anion gap, what is the anion gap? What's the definition of it? The renal tubulopathy, what's our clinical manifestations for that? Like first one that you may see, the initial one is going to be the excessive amniotic fluid or maternal hydroanimus. Maybe saying that wrong. All right. Heart, what was heart? All right. And what do we do for that? Gray matter, what's it composed of? White matter. All right, what's the significance of white matter? Myelinated neurons are found where? Where do we find them? How do we prevent meningitis? All right, and CNS injuries based upon if it's at the C4 level, what do we expect for that type of patient? Are they going to be moving? Do you think they'll be on mechanical ventilation? Do you think they would, have one-sided weakness or hemiparesis? So what is our manifestations for that, or what we would find? Multiple sclerosis. What do we do with somebody who has MS and they're trying to prevent fatigue? What are some best nursing interventions for that we could do? What is the purpose of the blood-brain barrier? All right, why is it? What's its purpose? All right, Parkinson's. What's the main neurotransmitter, and what are some of our clinical manifestations we would see for individuals with Parkinson's? Okay, what are some different things? Chapter 11, which we did not cover, but some of the things that you would definitely come prepared for is ADHD. What is ADHD? Bipolar. What does that consist of? Okay, so chapter 11 is our mood into mood stabilizers. What's one of the primary factors for mood imbalances? Is it family history? Is that like one of the greatest risk factors is family history of it? Depression, what is the one depression that is related to weather or environment? What's that called? Schizophrenia, what are some clinical manifestations for individuals with schizophrenia? Hallucinations, delusions, what do we expect to see with them? What does the autism triad consist of? Okay, and we'll obviously go in detail tomorrow. Then what is the main system responsible for our mood? It's the limbic system. That is our system that kind of regulates our mood. All right, so again, cervical spine at different C levels or T levels, what do we expect? All right. When it comes to the neuro, we already talked about in class how they can have seizures because we got some brain dysfunction. So when you have somebody that can have a seizure, a tonic-clonic seizure, what do we do first? What's the first thing we need to do? What's our goal as a nurse? We want to prevent injury, right? Okay. If we have a potassium imbalance, what can we expect to see? What's one of the first clinical manifestation of a potassium imbalance, whether high or low, right? Where does potassium play a big role in? The heart. Hydrocephalus. Forgot about that one. What is hydrocephalus? Accumulation of fluid on the brain. What do we do for that? Right? What is the treatment for that? How do we get that fluid off? What neurotransmitter? When we're looking at your neurotransmitters, what table is that? Table 11.1. All right, you do need to know those. So you got your dopamine, your norepinephrine, your serotonin, glutamate, GABA, and acetylcholine. What does acetylcholine do? Okay, what's its function? What's its function of dopamine? When we talk about attention, when we want to, like how much attention do we have doing projects, papers, schoolwork? What is some things that's true about it? Is it cognitive? I mean, how much attention do you have? And is it also a behavior? Do we choose not to pay attention? Do we choose to be doing other things when we should be doing those things? So is it both, or is it really just a behavior, or is it both cognitive and a behavior? Okay, what is bipolar? Kind of went over that again. When people suffer from a bipolar disorder, what do they go through? Periods of what? When we are, so ADHD, okay, attention deficit hyperactivity disorder. Okay, what is that actually? What kind of functions? What's going on with that type of individual? Okay, what kind of disorder are they having? Okay, what's the primary composition of our white matter? Okay, and what's the purpose? What does it, when we talked about white matter, what can it distinguish? Our neurons, the myelinated neurons, where are they found? What's their purpose? What's in the gray matter? What's it composed of? When we talk about anxiety, what does anxiety include? When people have anxiety, are they irritable? Are they restless? And do they sleep well? All right, so when people are suffering from anxiety, they usually they manifest those symptoms, correct? Normal values of electrolytes, like I said, sodium, potassium, calcium, hypocalcemia. What are some clinical manifestations? All right. Schizophrenia, delusions, hallucinations. What's the definitions of those? MS, multiple sclerosis. When we have flare-ups and exacerbation, followed by relief, what's it called? Okay, we talked about it in class the other day, we got all 4 different ones, so knowing those. Okay, so what is that called? Your sympathetic nervous system. Okay, and your peripheral. What? Give me an example of that. What does that entail? So know your sympathetic nervous system. If you have somebody who has an electrolyte imbalance or possible, what are we going to be looking for? Okay, so what would be our clinical manifestations we would look for or we would test? Okay. Dehydration, what are some of our clinical manifestations for dehydration? Lab values that will tell us if we are acidic or alkalosis. Okay, so normal pH. You need to know your normal pH levels and when we're falling below or below, above or below, what does that indicate? Okay, what do we expect to see with Parkinson's? What type of clinical manifestations? Facial, gait, extremities. And then teaching. How do we teach parents with cerebral palsy, parents with children with cerebral palsy? What are some things we should be teaching them? What would indicate they need further teaching? Know the definitions of what a mood is, what attention is, and what behavior is. Okay, there are different definitions for those. Why is MS considered a multifactorial disorder? And what does that mean? All right, and what is the anion gap? What is that actual definition? All right, hopefully this helped guide you in the right direction on where to study and what to look for in the book. And please come in prepared for chapter 11 tomorrow.